Eyewitness News Today, coverage you can count on.
Good morning. What a beautiful, beautiful November day to be outside on our back porch talking with Dr. Rob Headrick with CHI Memorial Chest and Lung Center. Good to see you this morning.
It's great to be here.
You have been making me feel better, I must say, because November is National Lung Month. A perfect time this year more than ever to be talking to you about the health of our lungs, because COVID it tends to go for the respiratory tract, right?
Well, COVID and all the viruses that tend to thrive this time of the year with the cooler temperatures, the dry air, the target's the lungs. So that's why we want everybody to kind of step up. Let's get everybody's lungs in shape. Let's keep everybody away from me and the hospitals.
I think that I mentioned how you've been making me feel better. You have a great optimism about you. And so rather than looking at this from a position of panic and fear, you're looking at it from a position of empowerment. And you worked really hard a few years ago to get a mobile lung screening to Chattanooga, and it sure is helping you this season.
Well, it's ideal we had no idea the coronavirus was coming. We had no idea the fear and panic that everybody was going to have with this season coming up and what everybody's been through. And what better way to help people is if the lungs are the target for all these viruses and illnesses, let's get everybody's lungs in shape. Let's make everybody less likely to suffer a bad consequence, get into the hospital. Let's make their holiday and winter much happier.
So one of the things that you hear so often in conversation or on television about people getting diagnosed with COVID is the first question is, did he or she have an underlying health condition? You said that maybe this is making us all more aware of how important it is to know about our own health.
Well, if you try to look at the positive side of all this, it's been a wake-up call for America to say how unhealthy we are as a population. Whether it's just our social habits, whether it's how we've interacted with people, whether it's just our own, whether it's simple as vitamin D deficiency, lack of exercise, obesity. I think it's a time for all of us to say, all right, let's step it up a notch. We got too lazy and out of shape.
So give us a little bit of an education 101. We'll go to med school with Dr. Headrick this morning about the status of our lungs. Is it true or false that if you have damage to your lungs, there's nothing you can do to reverse it?
If some parts are permanently damaged, already turned to scar tissue, the majority are in a state of inflammation, and that's what you can calm down. Just as if you were thinking of it, a joint, a knee, or a hip, if you cut that inflammation down, they're going to work better. So our goal is to get somebody to look at their lung tissue, first make sure they don't have lung cancer with this scan, and then look at ways how we can cut inflammation out of their lungs and make them breathe better, but also less susceptible to all the viruses.
It won't surprise anyone, I'm sure, to hear Dr. Headrick say that stopping smoking, including e-cigarettes, is a big key to accomplishing that lung health.
Sure, and there's obviously people do it because there's an enjoyment, there's an addictive component. It does make that inflammation in your airway a lot more pronounced, and that makes viruses much more easier to get into our system. So you're about 7 times more likely to catch the flu, catch the coronavirus, if you're chronically using e-cigarettes or regular tobacco.
Different things motivate different people to stop, right? So the idea that you're more susceptible to becoming sick in other ways might be the very motivator someone needs to hear. You were telling me that there's a receptor in your lungs that when it's inflamed, the virus kind of grabs hold of that. Is that kind of it?
Well, it makes it much more easier to get into our system, the lungs being the target. If you were to get sick with the flu or the coronavirus, it's just not fun. We also think there's going to be some long-term damage that you can't reverse. What the virus does in our lungs, it forms this gel that you can't get rid of, and we're worried about someone's long-term health, ability to breathe. So the best thing is, put those e-cigarettes down. Let's get our vitamin D levels up. Let's exercise a little bit more. Be more aware of our bodies and just don't get it.
Okay, with that long-term negative impact on your lungs if you get COVID, is that, do you think, across the board or just for people who had lung damage to begin with?
Well, I think it's going to be that small subset who gets in the hospital that we see this picture on CT scans where they're struggling to breathe. I think it forms this gel inside the lungs based on this hyaluronic acid that the virus produces that is causing the long-term impact, and in some people the inability to reverse the damage and leading to death.
You can't talk about COVID and not talk about the psychology that it brings into our daily lives. So for a lot of people, it's been kind of literally a depressing year because they've been in isolation. One of the main things a psychologist would tell you is to get out and be a part of the day. You say that has added benefit because when you have vitamin D, that boosts your immune system.
Right, so just getting outside 2 or 3 days a week, it's a little bit harder to get sunlight this time of year as the sun's lower on the horizon, taking some vitamin D supplements, but just physically doing 30 minutes of exercise a day will help your immune system.
When it comes to lung cancer here in the Tennessee Valley, that was the main reason, I guess, that you brought the mobile unit and these screenings, because you wanted people to understand where their lungs were and find out early on if they were kind of on a path to lung cancer. Is that right?
Well, we know we can use modeling and data to predict who's likely to get lung cancer. That's the great part about science. And then how do you go to those people and start looking at them ahead of time before they get it or in the early stages? And that's what lung screening does. Simple tool, easiest test in the world. Now with coronavirus on the horizon, we understand how more important the lungs are. So not only getting the lung screening to just check off you don't have lung cancer and we're good, but let us look at your lung health and make you positioned to get through these winter months much more likely.
Okay, tell me if I'm right or wrong. The idea with the lung screenings is that you wanted it to be as accessible to people as possible.
Yeah.
So if you are in that risk category, is there a charge?
So if you're over the age of 50, have any smoking history or family history of cancer, worked in a foundry, shipyards, there's no charge. Outside of that, we have grant funding if somebody can't afford to pay for it. So the reality of it is we can get the lung screening done without worrying about the financial piece of it. The most important thing is being aware we're in a community where lung cancer is so prevalent. One person every 2 hours is dying. And we're in a community where our lung health is not great for viruses and other illnesses are coming this time of the year. We just want to do better. We want Chattanoogan's and people in this area to live good life and breathe better, and this is just one step to making it simple.
There was a time, I think, when to hear that someone had a lung cancer diagnosis would have been terminal.
Right.
I believe you told me that the treatments have really improved.
If we find it through a screening test, 90% cure rate.
Really?
So, the optimism is just like I think with the coronavirus, we're going to get through this. I read at night all the data on the vaccines. I'm looking at the scientific piece of it. There's a bright light at the end of all this. We just got to hang in there.
There are situations that there are viruses other than COVID, and I'm sure that's important for you to stress. We are on the cusp of the flu season. Pneumonia often rears its ugly head this time of year. Where do you stand on the pneumonia vaccine, for example? Is that a good idea?
It's one more thing that I think people can do to make sure that they're doing everything to stay out of the hospital. So yes, pneumonia vaccine. Please get your flu shot. Our hospitals are filled not with coronavirus, they're filled with people with strep infections, with influenza infections, all the normal stuff that's still happening. There's so much we can do to be more productive than spend time in a hospital.
So you want to make sure people realize that wearing that mask does not make you Mighty Mouse. You can still get
correct
illnesses.
It reduces and it helps. It's one of the many list of things to do. I think our starting point is come see us. The mobile unit was simply to make the visit painless and quick and easy. Let's figure out what we can do to keep people in your viewing audience healthier and keep them out of the hospitals. That's all of our goal.
So how do you want them to get in touch with you? Should they call the office and request either coming in person or the mobile unit?
495-LUNG, L-U-N-G. Simple number. We'll tell you where the bus is going to be and make it simple for you to get there. We can... if you're an organization, a church group, any type of service organization, we can bring it to your organization. The goal is really to make healthcare easy.
Well, it was a wonderful gift that you brought to the city of Chattanooga when you fought so hard to get it here. So we thank you, Dr. Headrick.
Thank you.
495-LUNG. You can also go to mylungcare.org. He's part of the Chest and Lung Cancer Center at CHI Memorial. We're back after this.
These days, there's not a lot of getting out of town. So how about staying in?